Recording, I'm sorry. All right, we are live on Planetary Health First, Mars Next live, meaning just recording digitally. But anyway, when you hear it and see it, it is live in your experience. We have an amazing guest. Maria, do you want to just share a real quick little bit about yourself before we get going?
Yeah, absolutely. So I've been in the healthcare space for over the last 14 plus years, working on a variety of topics and organizations. So really focused on the value-based care space, but have seen the industry both from the provider perspective as well as the payer perspective, and have delved deeper and deeper into technology throughout my career.
Cool. Well, I am glad to have you on. I know a little bit about value-based care. I know we haven't seen enough of it, whether it be a percentage of the GDP or whatever the total healthcare spend. We need more of it. We all know that. And then the other thing is, what is value is the hardest thing, I guess, operationally to define. But I guess that's where you come in with data. You have no value if you don't have data. Would we agree to that as a universal principle?
Absolutely. I think data really helps to drive all of the strategies and all of the initiatives that a value-based care organization will need to implement, because without data, you really have no way to move forward.
And I love your background. It sounds like you're really well positioned to be doing what you're doing with the former roles you've had. Tell me a little more, dig a little more deeper with sort of companies, just to help our audience know why they should really be, really why they should be listening to you. They should be.
Perfect. Yeah, absolutely. So I started my career in consulting when value-based care was in its infancy, and working on practice transformation for the patient-centered medical home. So traveled the country, helped practices become patient-centered medical homes. Then transitioned over to the payer space and helped to develop operationally the Care First Blue Cross Blue Shield PCMH program, the Patient Centered Medical Home Program. And then, as I said, I delved deeper and deeper into tech. So after I left Care First, I went to Aledade when it was in its infancy, actually, and helped to develop their strategies and initiatives across the country, helping their now accountable care organizations that then started right around that time, and worked with all of the executive directors at Aledade to test out whether our strategies worked. And in fact, they did. And at the time, we were only working on the Medicare Shared Savings Program, the MSSP program. And knowing that multi-payer was definitely coming and that commercial insurance was going to be interested in delving into the value-based care space, I transitioned over to Salient Healthcare. It's a performance management company, and helped to build their multi-payer platform. So really delving deeper and deeper into tech. Then moved over to Closed Loop AI, which is an artificial intelligence company. They'd won the CMS Health Outcomes Challenge, one of the most prestigious AI initiatives out there. And so I helped to develop some of their partnership programs and business development programs, partnering with large organizations like Amazon. And that's when I decided that I'm going to start Revelar Analytics, which is where I am today. So today I am the CEO of Revelar. And what we do is we focus on price transparency and using price transparency data that's publicly available to help both value-based care organizations as well as those that are still on the fee-for-service continuum use and leverage that data in meaningful ways.
So tell us, like, who are your clients? Who would be the customers that would really benefit from this?
Yeah, so there's a number of organizations that might be able to benefit from the new price transparency data. And I'm happy to give a little bit more of a background as to kind of what the rules and regulations are, how it got started, et cetera, et cetera. But so provider organizations most obviously can help benefit from that. Up until this point, what providers weren't able to do is understand what a fair market value compensation would look like in any given region. So, you're going in to negotiate with a payer and you have no idea what is fair. So, what we're seeing in the data, for example, is that even though an organization might have really good quality, they're getting paid 3 times less than the competitor literally across the street. And
Mhm.
so, um, understanding what is fair is really important. So, provider organizations, both really small provider organizations like solo docs, that really have no contracting team, or alternatively, really large organizations like hospital systems, for example. Anybody that negotiates both fee for service as well as value based care contracts can leverage this price transparency data. Now, we've also been approached by health plans to also help understand what is fair market value. So they know what, their negotiated rates are, but they want to understand what others in the market are also reimbursing providers. Because again, what you'll see is variation in price across payers. Um, Self-funded employers have taken an interest in this, and there are some initiatives out of Indiana that are really interesting that are coming out in the self-funded employer space. Not necessarily our client, but just out there as an interesting opportunity. And then investors as they're looking to do mergers and acquisitions. So, what does fair market value look like? So, previously, you would use survey data for these fair market value assessments, but that was self reported. This is just straight data that is the source of truth.
No, that's awesome. I love it, and I feel like it's still a pain in the butt when you go to the store and you look at what ounces when you shop. It's so you're even probably making that way more easier and effective in healthcare. But I can imagine too, and the little I know with healthcare, just like with the health plans in general, there might be Blue Cross Blue Shield or whatever brand of the 6 year period that they call themselves. It doesn't matter if you're in Connecticut or you're in Alabama. Those are totally so you must have a machine that company you have of yours is pulling data everywhere and slicing it and dicing it and creating some really super cool dashboards and all these. Anyway, I could only imagine that AI thing behind the machine or your brain power. So I'll stop when I'm
Yeah, let me tell you a little bit more about just price transparency as a background, because I think you really hit the nail on the head in terms of the complexity of some of this data. So there were actually two price transparency rules. The first one came out in January of 2021, and that was for hospitals to actually go ahead and provide clear, accessible pricing information online to consumers. And so, there are many hospitals that are complying. There's some that are non-compliant even at this time. But either way, that information is really, really difficult to decipher. There is currently no standardized schema in which they have to provide that data, although there is a regulation that just came out as a proposed rule to have to make that accessible by the end of the year. So, kind of a little bit more uniform, if you will. Then, in July of 22, another regulation came out making the plans and payers and insurers going into effect, basically making the transparency and coverage rule come alive for them as well. So now they have to publish that price transparency data as well. Now, for the plans and insurers, that schema is defined. It was defined by CMS. And so they need to conform to a specific standard when publishing these machine readable files. Now, as you pointed out, what we're doing is we're making them human readable, but machine readable files are out there for anybody to
Mhm.
access. So the listeners today can absolutely go on to, as you noted, any of these insurers' websites, click the download link, and in theory, be able to get access to that data. But I make it sound a lot easier than it actually is.
Yeah, it's like, go ahead. If you want to go build your own house and you're not a general contractor, go ahead. Go to Home Depot. More power to you to build your dream home, I don't know, 10,000 square foot dream home somewhere. Go for it.
Exactly. Yes, that's a really good analogy, actually.
And I won't patent and sell that to your license it to you today. But Marie, I'm glad you're here. I feel like we've stumbled across each other periodically. It's been a while. We've had conversations, and I'm glad we got you on the show. I think this is really important. I think the little I knew, I think this was starting to come out. This talk about price transparency. And it sounds like yours is really a B2B play, because as a consumer, I've seen some plays, consumer play, and it's just a failure. And I'll just let me finish. Is all right, great. I want to get an MRI, and I'm in the zip code where Virginia Beach is. Well, good luck. All the companies, the one company or two companies that own an MRI, it's the same price whether I have an insurance or not. And maybe it's changing a little bit, but it seems like you're really solving this from a market competitive landscape and moving healthcare forward. So I'm glad maybe there is, a 2.0. We'll get there with consumer and some cool consumer companies. I'd like to think that, but I'll stop because I'm talking too much.
Yeah, I would definitely agree. I think from a consumer perspective, it's absolutely key. Consumers really do need to understand what the bill is going to be before they receive a service. I've had personal run-ins with this of, hey, you need to go get this service. Okay, well, what is it going to cost me? And people are shocked when I actually want to understand what the cost is before I sign up for something that's fairly elective, maybe necessary, but could be put off a month or two. With any other product that's out there, before you purchase, you know what it's going to cost you. I need to do a home improvement project. I know what it's going to run. I go to the grocery store to purchase a jar of peanut butter. I know that I can perhaps shop around and, get the generic version of it and know exactly what it's going to cost me before I go to check out at the register.
So do you see this eventually being a consumer solution as well?
I don't think that we are going to go into the consumer space, but I certainly see that there's plenty of opportunity for other organizations to get into the consumer space, and to help make this absolutely accessible for consumers as well.
But what you are doing is creating that marketplace potential with providers to create that better value, if you will. I mean, right? And so this is a weird question that I heard, and I know, forgive me for going off topic, but someone had shared from Kaiser Foundation. I think there's a data point, and you seem like I mean, I know you're super smart, way smarter than I'll ever be when I grow up. That ever since like 1960 or so, forgive me, the pie of healthcare spend, whether it goes to pharma, SNFs, hospitals, it's been about the same. And it's just the GDP and the amount of that pie has just gotten bigger, but every slice of that pizza has been about the same. Is that true? And why is that?
Yeah, so I've seen that over my career as well, where the pie is fairly consistently about the same. Utilization might have increased, but the proportions are remaining fairly similar. So what you see year over year is an increase in spend, which is why going back to, the original topic, value-based care is just so important, because I do think that it'll, first of all, reorganize portions of that pie. What value-based care does is help keep the patients healthy, keep patients from experiencing unnecessary exacerbations in their conditions. And I don't think there's anybody out there that specifically wants to go to the emergency room, for example, for an exacerbation. They'd rather be at home spending time with their family as opposed to, in the ER, for example, or at the hospital for unnecessary conditions that could have been avoided.
I have a father that's on hospice. He's 91. He's had a remarkable life. Very few people make it to 91. I don't care where you are, what country, or whether you're even in the blue zones or whatever. But I found, looking back, while he's still, we're still delivering care and doing everything we can. I just wish, and maybe there is some value-based initiatives that you could see. It seems like 3 years ago would have been the right spot, not hospice, but not going to the hospital. And I don't know why there isn't enough. I know it's very complicated from us as a, my feeling as a son is different than my mom or my other three children. Um, but when you look at it objectively, he's frail, medically complex. He has the MRIs, he has the CAT scans, but they all know they're not going to do surgery. When are we? What is stopping us as a nation to have these real conversations and have these real options? Because I think if my mom was educated and given the power by the nurse practitioner, palliative care, um, a, a time before that hospice, those unnecessary readmissions to do nothing but hydrate, like that's real value-based care. But I don't see, when you talk about it as a big concept, it sounds great, but individually it's a mess. So I'll stop there.
Yeah, end of life care is extraordinarily expensive, and so what you see is the majority of spend going towards end of life care, and especially in the last days, if somebody's not on hospice, they're going to do everything they can to keep a patient alive for another couple hours, but the costs are astronomical, and I've seen that from claims data across everything that I've done, prior to Revelar, and so what you have is as a population health concept, that's great. Yes, we want to keep end of life costs down. You're maybe adding another day or two for that patient. They end up unfortunately passing away in the hospital, not surrounded by family, very uncomfortable, getting a lot of unnecessary tests that then don't result in any actual treatment or intervention, if you will. And, you know, most people, when asked, there's been plenty of surveys on this, would rather die at home comfortably and, have a really high quality of life leading up to their death. And so it's a really, really important initiative. Absolutely agree with you. But when primary care providers have been surveyed, they feel uncomfortable having that conversation with the family. It's not a conversation that anybody really wants to have. There are codes actually helping providers get reimbursed for that. But for them, it's not something that they feel comfortable with. It's not something that they went to school and were actively taught to do. And so that conversation becomes increasingly just a difficult conversation. And so the general public, such as family members, are not well educated about this concept of end of life care, unfortunately. And then they end up doing just everything possible to keep somebody alive for another couple hours.
Yeah, I've heard from a friend of mine that shared a CEO of a hospice care company. The average is like 12 days or something for the length of stay because of it seems like that. And you can't really expect the families to do good when the primary care is not comfortable with it. So it seems like that's a big cultural change that, they're not in medicine and healthcare, they're trained to save, not to do nothing. So it seems like that's a whole ball of wax. But I'd like to shift the conversation to, you have oncology, cancer, research, all these different things that where does your price transparency, does it cover these sort of outcomes at a granularity if some group wants to do some new initiative or however it be, like cost, but I'm not a health economist, but could you get into some really cool off the wall sort of possibilities someone could put together through using your tools or how you do it?
Yeah. So one of the most interesting use cases that we've been thinking about is using it for medical devices. So really off the wall, understanding when a device wants to go to market, what has been the reimbursement for certain procedures? So what is the ROI of, for example, a medical device? How do they price that, given the fact that a provider is going to get a certain reimbursement? So let's take hips, for example. You get a hip replacement, you obviously need a medical device. Somebody's getting reimbursed X number of dollars for doing the procedure, but you got to factor in some of the medical device costs as a result of that. So, what's the go to market strategy for that?
I'd love for you. Do you have anything on remote patient monitoring? It seems like that's been something that just few companies have been able to actualize, realize that, and it's like the Wild West still, I feel like, Can you share a little bit about that?
I've not looked into the RPM space in terms of what the codes are, just I haven't looked
Mhm,
at those codes. There's just so many different codes out there that one can
mhm,
investigate and see. But basically, the price transparency data gets down to the NPI level, the tin level, so you're able to exactly see what everybody's making or what their negotiated rate is for certain procedures, as well down to the CPT code. So if we know what the RPM CPT code is, which of course we do,
mhm.
um, what you can then do is pull down that data and say, what does it look like across the country? How are certain providers getting paid for it? What's the variation across payer? And that goes just not just for RPM services, but annual wellness visits, transitional care management services. And we've seen certainly great variation across both payers as well as regions in the costs associated with some of these fee for service value based care initiatives.
So what gets you excited about this? Obviously, you don't just wake up and say, I'm going to start a company, become CEO. Like, what motivated you?
Yeah. No, that's not what happened. Yes, there is a backstory to how we got started, and a real example of how this price transparency data can be leveraged. So, our current chief medical officer, our CMO, actually came to me with a problem one day, and he's a pediatric urologist here in Maryland, and he was doing surgeries, and some of the surgeries that he was performing was basically so low in terms of reimbursement that his costs weren't being covered. Staffing, the equipment that was used, that needed to be placed into each patient as a result of the procedure, just literally wasn't being covered. So you're breaking even. You're basically doing free surgery for all intents and purposes. He's like, there's no way that my competitors are doing the same thing. They've got to be making more. How do I find out? So I told him to go leverage these price transparency files. I'm like, well, they should be out there for the public to go and download. So I highly recommend you go and download them. So a week later, he comes back. He's like, so I tried to download them and I don't know what I'm doing. Can you help me? I'm like, well, spent 14 years in this industry. I've been working with large data sets. Let me try to do it. And so having that experience, I went in and I clicked the download button as well. And I got a little further than him, but not much. All I was able to do is download a table of contents. And there's links in this table of contents. So I'm like, you know what? I don't think I can do it. So we enlist the help of our now chief technology officer, who's a former friend and colleague. And so he's like, "I think I got this." He now works for the federal government working with, secret large data sets, and so, he's like, "I got you. I know how to do this, but I have no idea." So then he downloads it, decodes it, making this machine readable file human readable, opens it up, looks at it, goes, "Yeah, so I, have an Excel sheet for you, but I have no idea what this says." I'm like, "Alright, send it to me." So he sent literally an Excel sheet to me, and I'm like, "Alright, I got you. I can do the data analytics on Excel." So that's how the company got started. So I did an analysis for our now CMO, and sure enough, the variation is about 3x here in Maryland for, the procedures that he had asked me to look at originally. And, he's now actively, trying to renegotiate these codes. And so we figured others in the country would be able to leverage the same data. Just again, what is fair market value? How much should you ask to get paid for something? What's fair? Is it, a inefficiency problem on your end, or, should you be getting paid more?
Wow, that is I'm glad I asked that because just to let all our listeners know, this is fully unscripted. Is that correct, Maria?
Absolutely unscripted.
Is this the best podcast you've ever been on in your whole life? And don't answer it if you've never been on one, but just regardless, you got it. Not no pressure.
I've certainly done plenty of podcasts, and yes, this is fantastic.
All right, good. You're smart. She's well versed talking to all different people. She answered the question without answering. I love that. So anyway, where do we go? We still have some time left. I don't want to monopolize this. I want to realize, let's say, value on this call, on this podcast. Let's take it to the next level.
Yeah. So, we've talked a lot about how organizations can leverage this data in a fee-for-service manner. So, what does reimbursement look like when you do a single procedure for a single patient in a single instance? I think this data can also be leveraged across the value-based care continuum. So, I said in the beginning that whether you're on the fee-for-service side of the continuum and just trying to dabble in value-based care, um, and getting reimbursement for annual wellness visits, transitional care management visits, chronic care management services, RPM, as you've noted earlier, you can leverage this data to understand what is fair market value to get reimbursed for some of these procedures, both at the primary care level as well as specialty. What you then end up getting into, kind of in the middle of the continuum, are bundled payments. What we're able to see are bundled payment arrangements in this data as well, and not just us, but any price transparency vendor or a consumer, if they're able to actually download some of this data and make it human readable from machine readable files. Um, but what's interesting is, again, what does the bundled payment rates look like? How does a provider get into a bundled payment arrangement and understand what they're getting into? And then all the way on the other end of the value-based care continuum, full risk contract. So should you take full risk? What does that look like? Leveraging some of this data for those arrangements as well can be absolutely instrumental, especially as organizations are looking to build their preferred provider network. So I spent a really large amount of my career helping to establish preferred provider networks across skilled nursing facilities, home health agencies, hospice care, et cetera. And so the variation in cost there, and I've seen that from claims data, is extraordinarily large. Again, you have a 3x difference, and then you add in some, I'm going to call them data enhancements. So quality data. So not just cost, because cost is one factor of the value-based care equation, if you will. What does quality look like? So I think that's the direction that we really need to start looking in, is what does cost plus quality look like to establish who are these high quality organizations that are also delivering care at a reasonable, fair cost?
So, is there another factor with quality? I mean, cost, quality, I guess, is outcomes part of quality? It's there other.
Yeah. Cost and quality is such a large topic, of course.
Okay.
You have quality outcomes of, is this patient going back to the hospital? Readmission rates. Are they being stabilized and managed? Bundled payment arrangements, looking at who has the best outcomes for certain procedures and surgeries, is just such a robust topic. What we're doing right now is we're building data enhancements into the price transparency space. So not only are we providing just raw data and decoding these files, so we've come a long way since that initial story that I've talked about of Excel spreadsheets being sent back and forth via email. But we're also building in these data enhancements to help organizations understand what does quality look like, taking noise out of these files to help understand cardiology to cardiology. So a lot of these files have a lot of noise in them. So nonsense data, phantom codes, basically looking at cardiologists building chiropractic procedures. That doesn't actually happen, but it's in the file just to
Mm.
create more noise and confusion, if you will. So,
Wow.
that's some of the data that needs to be parsed out and investigated and, you know, be made usable, if you will. Um,
So now when you're sleeping, do you sleep data? Do you see data in your sleep?
I think I do at this point, for sure. It's how do we combine some of these files? And yes, I wake up in the morning with a new and crazy data enhancement from my tech team. They're like, Maria had a good dream last night, didn't she?
Now, I don't see, I mean, I see you as a CEO. Obviously, you have some technical knowledge. I don't like to use the word nerd, but it seems like this is a self-taught through the years of profession, learning it. Like, I don't know what your major would be, but I would not think it would be, I think it would be more on the communication, forgive me. And you've learned this yourself by just doing it, and working in all the different networks of the provider networks and real, I'll stop.
Yeah. Really great question. So I actually graduated with a pharmaceutical marketing and management undergrad. And the thing that got me excited, even going into this space, is a class that I took about learning how health systems work. That was the intent of the class. However, my professor, who was absolutely brilliant, Dr. Don Zimmerman, was teaching us in the way that health systems don't work. And our capstone project was please define how we can make the health system better. And so, everybody, we didn't know the concept of value-based care at the time. Now I'm dating myself. Um, and so, everybody came up with really creative ideas, and I knew that there was a better way of doing this. And so that's when the patient-centered medical home just came out. So I
Mhm,
dove in head first into that space. Um, so a lot of it, yes, is self-taught. And my other background is in law. So graduated with a master's of jurisprudence in health law and a certificate in regulatory compliance. So a lot of these regulations, I was able to really interpret, read, understand what's required, what's not required, and what's in there to help us make sure that this is a sustainable solution, because what I don't wanna do is create a whole company around price transparency just for them to pull the rug out from under us, change the schema entirely, and not publish what they're required to publish. So, it's been really interesting having those 2 kind of backgrounds, but a lot of the, like you mentioned, data analytics, data nerd component is completely self-taught from
mhm.
experience in the industry, having seen what I've seen. Um, I don't code systems, but I certainly can write data requirements for the tech team to be able to implement.
Mhm. It seems like you have the best skill set because I like what you added is the moat. The moat really is, of course, all your years, but the legislative, regulatory, all that understanding the law, because that's really, you just don't know. I mean, my gosh, if we get the next election, I'm not trying to get political, but this is a ever changing landscape. So that really is, you got to really be able to read that and be at the pulse of that. So just like they give you that data sheet, hopefully they're not going to make it more user friendly for you, right? That you'd like them to make it machine readable only, for your sake. But uh, you know, tell us a little more, what you think would be important for our audience to hear if they're, healthcare professionals, providers, even payers, just anything else that could help us better understand what you're up to and why this is so important.
Yeah, so I think really important to be armed with data to make decisions. And so no matter where you get this data, whether it's price transparency data, claims data, EHR data, there's so much of it out there. It's just really important to get access to it and then know how to make sense of it. I think that that's been a theme throughout my career because, organizations in value-based care are getting so much data thrown at them and understanding what to do with it and how to use it and how to leverage it to have a strategy in place to ultimately put the patient first, take care of them, and keep the lights on is really critical.
So Maria, is there any conferences you'll be attending that is an annual must for where you are and what you're doing?
Yeah, so we just spoke at the National Price Transparency Summit back in April. And so it was an excellent conference, really bringing in thought leadership. So I do hope that they make that continue to make that an annual thing. And so it's been an excellent conference. There's plenty of value-based care conferences. We attended NACOS year over year for value-based care. They haven't focused on price transparency data. But there's also another conference coming up here in September that we'll be speaking at as well. So, you know, price transparency has not made its way squarely into the value-based care space. All the conferences that I used to attend, hopefully will be bringing price transparency information to them as just one of the key measures. But there seems to be lots of new price transparency conferences that are just coming up on the books.
Awesome. Awesome. Is there anything as we're kind of winding down that you'd like to share with our audience, how to find you, anything?
Yeah, feel free to message me either on LinkedIn or email me at marianicole@revelaranalytics.com. So always happy to chat and connect with like-minded folks in the industry.
Well, I hope we can have you on in the future with maybe a panel. I think this is something that we could see more of, an interest, nuance with maybe user cases and maybe partner provider groups that are using the solutions. If we could figure out the right topic, I think that would be very enjoyable and very helpful and informative.
Absolutely, would love to.